I love that song. Thank you. Love Prince. Hey, everybody. Thank you for being here for another terrific edition of Deborah Kobylt Live. And we are doing a book series today. We've got different authors on various shows that we're recording today live at the Sunset Gower Studios here, which is always a fun place to be. You never know who you're going to see in the hallways when we're roaming around here. You know that? I'm always looking for Kerry Washington because they do Scandal here. So I'm always sort of roaming around hoping to find her. Anyway, today I'm honored to have Dr. Vanessa Grubbs on the phone. Dr. Grubbs is a nephrologist with the Zuckerberg San Francisco General Hospital. She is also one of two African Americans to graduate Drew University Medical School at the time that she was in school, which is pretty incredible and remarkable. You're a very brilliant woman, and we need to see a lot more of that. So thank you for raising the bar there and getting things moving on that end. But you have written a book, Hundreds of Interlaced Fingers, a kidney doctor's search for the perfect match. And a little bit about you. I should probably have you tell your own story. But essentially, you gave your kidney to your boyfriend or fiance at the time, some years back, and that sort of set you on a journey. Is that correct?
Yes, that is correct. But one small correction, it was Duke, not Drew.
Oh, what did I
where
say?
I went to medical school.
Oh, my Lord. I'm very sorry about that. Okay, Duke. Sorry about
Don't
that.
worry.
That is a big mistake, and I'm sorry about that. Thank you for correcting. Okay. So anyway, would you please tell me a little bit about your journey? You were a primary physician, and then the person that you were dating at the time, he is now your husband, but he needed a kidney.
Mm-hmm.
I have to tell you that is very brave,
Yes.
because look what happened with George Lopez, right? He was married, and he left his wife after that kidney. You know, it leads you to wonder. I mean, did he? You know, some people stay for the money. This guy, did he stay for the kidney? So, so tell me a little bit about your story.
Yeah. So, yes, that's right. And first of all, thank you so much for having me on your show.
Pleasure.
I was a primary care doctor when I met my husband, and he had been on dialysis for a few years at the time already. And it was through the course of our relationship that I just got a very insider view, so to speak, of what it's like for a person living with kidney failure, as well as our kidney transplant system and all the barriers there are, messed up things. I'm trying to choose my words carefully here.
You don't have to be careful on my show. Just let it out.
And it was all of that really motivated me to not only give him one of my kidneys, but also ultimately to go into nephrology so that I could really try to do research that would help remove some of the barriers that we see, particularly for people of color, in trying to get a kidney transplant.
Tell me what some of those barriers are. I read that 1 in 3 people who are in need of a kidney are, in fact, African American. Is that correct?
Mm-hmm.
And
yes, blacks make up about a third of the deceased donor kidney transplant wait list, and so do whites. But at the time of when I donated, which was in 2005, and I don't think it's changed that much since then, unfortunately, whites would get every other kidney, but blacks would just get 1 in 5 kidneys. Which meant that blacks ended up waiting nearly 2 years longer to get a kidney transplant than whites.
Are they giving any kind of reason for that? Other than the obvious reason, are they giving any sort of reason for that?
Well, I think the system is made in a way that disproportionately affects people. So, of course, nobody's coming out directly and saying because you're black. But, there's things within the system that disproportionately affect people of color and especially poor people. And since I've become a nephrologist, I've noticed lots of things before you even get to a kidney transplant. But within the transplant system itself, one of the big things from years ago, and I'm not sure exactly when it was, they tried to correct it, but not to generalize too much, but most black folks are blood type O and some B. And the thing about type O people, they can donate to anyone, but they can only receive organs from other type O people. So
I'm an
there
O.
was a time.
I'm O positive, so that's very interesting. I forgot about that. Yeah. So
Right.
yeah.
So that's one of the bigger factors. And so if O organs are preferentially going to the other blood types, then that's less available to go to blacks. Both my husband and I are O as well. My husband is black. And uh, so that they made a rule, and I forget what year that was, where they were trying to correct that and try to say that, okay, we're going to reserve some O's for O people. Another issue is the notion about it taking longer for people to get through the just navigate the system. There's a landmark study that showed that blacks were slower than whites to get through every step of the process towards kidney transplant. And one rule went into effect in December 2014 to try to improve that. It wasn't the stated goal, but that was one of the positive outcomes of it, in that they decided that regardless of when you were referred for transplant evaluation or when you finished that process, you after dialysis, you would your date for being placed on the wait list would be backdated to when you actually started dialysis.
Why? Because because they're saying you don't need it as much, or I don't get it.
No. So, for example, my husband, when he started dialysis, even though he was under the care of a nephrologist, it was under a very emergency situation. He ended up in the emergency room, and it was another year before he was referred for transplant evaluation. And then it was just because he brought it up to his nephrologist. He asked, "So what about a kidney transplant?"
So
And the
he brought it
nephrologist
up?
said, "Oh, yeah, sure.
The
Yeah, sure. Yeah, I'll
nephrologist.
refer you." So
Okay, why wouldn't he bring that up?
right.
I don't get, or she. Why didn't his nephrologist bring it up? I mean, I can't imagine you're sitting there on a dialysis machine and you're going, "Oh, excuse me, what about a new kidney?" I mean, I would think that's something the doctor would bring up to you, right? God.
Well, I think our system is very messy, and who knows what, motivations were. My husband was very young. He was only 27 at the time. And, I don't think the nephrologist was being malicious about it, but I think we're all guilty of having our own set of, unconscious biases or just whatever we think about people. And if you're in a position of power, then that means that you're in a place of that those biases having a negative effect on others. And I think the other thing about our system is dialysis, unfortunately, is big business, and
Huge.
nephrologists are paid for people being on dialysis. We don't get paid by the number that we refer for transplant or the number that we keep off dialysis. Now, I would like to think that we are all interested in doing what is best for our patients, but clearly we see that doesn't come out to be what is truly best for everybody.
I have experience with this, and I know you and I spoke about this on the phone yesterday. My father, who eventually actually died not long ago of kidney failure because we could not get the portal into his arm anymore because he was elderly and it just wasn't going in. And sadly, I had to make the decision whether to keep trying to put it in or not. It was very difficult on me, very, very difficult. And you mentioned also about prolonging someone's life on dialysis. I will tell you, my dad was extremely with it. So he was functioning fine on dialysis. It's just that his body was giving way. What do you have to say about prolonging one's life on dialysis?
Well, yeah, I think dialysis, even though everyone that I come in contact, people are afraid of it, understandably so. It's a scary thing. But it is, in a way, a miracle because 60 years ago, we didn't have dialysis at all. So everybody with kidney failure just passed away. So if a kidney transplant is not readily available for someone, and that is the case for most people, each year there are over 100,000 people waiting for a kidney transplant, but we only do roughly 17 to 18,000 kidney transplants a year, and most of those are from deceased donors. So that means that a lot of people are healthy enough to get a transplant, but there's just not enough to go around.
There really are not enough.
So dialysis.
Go ahead. I'm sorry.
Hmm.
There really are not enough kidneys because I know, I mean, are there just not enough donors? Let's talk about the deceased donors. There's just not enough out there. Is that what's happening? Because you're just,
Right.
go ahead. So, how
Yeah.
can we
So
get the word
the
out
waiting.
there to be a donor, to be an organ donor? Because that's so important. If you can't use it, let somebody else take a stab at
Right.
it.
I completely agree. And, it's, I get that it is daunting to decide to lay down and let somebody take out a part of your body while you're still alive. But at the very least, I think everyone should sign up with the DMV, register as an organ donor, and let your family know that you did, because once you're gone, the family will need to, verify that you are an organ donor, so that all your healthy parts can go to help others. And, even if, heaven forbid, that you've passed away from, cancer, and it's spread everywhere, your corneas can go to help someone see better or
You
see
know,
it all. So there's something for everyone, I think, to be able to do.
if people are afraid, you know what I like to say? It gives someone else the opportunity to live on. So even if you lost your loved one, God forbid, yeah, I mean, those corneas are living on in someone else, or the kidney, or whatever else that they can, manage to donate in time. So I actually like to look about it and talk about it that way. I know there's a lot of people are afraid to, donate. They're afraid to even put that down. It's like bad luck. And I said, look, it helps other people. If it can't help you, might as well help somebody else. What needs to change in this
Right.
whole process, in particular for the African American community, for Black people who are not really, who are not getting kidneys, according to you, according to studies, at the same rate that a white person's getting them?
Well, I think a lot of things need to happen, and a lot of them are easier said than done. For one, just prevention in the first place. Blacks are almost 4 times as likely to progress to end-stage kidney disease or full kidney failure than white people are. But our entire society is built in a way that really promotes that. Of course, some of the problem is what you inherit, but I am a firm believer that a lot of what happens is because of our environments as well. So if you don't have access to healthy food or clean air or a safe environment to go out and exercise in, then you're going to be much more likely to develop diseases like diabetes and high blood pressure, which cause 2/3 of the chronic kidney disease that we see in this country. But in terms of someone who already has kidney disease, and that's a big deal, because we have data that suggests that 80% of people with significant kidney disease don't even know it. So I really encourage people to go and get tested. It's just a simple blood test and a urine test that will pick up very early signs of kidney disease. You need to do it at least annually if you don't already know that you have something going on.
And
And
basically,
it's so important because nobody is going to feel anything. People with kidney disease usually do not have any symptoms until it's almost time to start dialysis.
you're
So
kidding. Wow.
that's why people should not wait till they feel bad.
What are some of the signs, briefly? We only have a few more minutes, of kidney disease. Is it more frequent urination, for example? Blood sugar levels?
No,
No?
no, there's usually really nothing. Some people with some particular diseases, their legs will swell, or their whole body will swell up really badly. But most people have no symptoms at all, which is why it's important to get checked. And within the system itself, I mean, people need to be in the care of a nephrologist in order to get a kidney transplant, because only a nephrologist can refer them. So, and we don't have any automated system for alerting patients or nephrologists to, okay, a person's kidney function is down to this certain level. They can be referred for kidney transplant long before they even start dialysis. So without any kind of systematic way of alerting doctors and patients, then that allows a lot of people to fall through the cracks, and things like what happened to my husband. He was in the care of a nephrologist since the age of 16. So he could have been on the wait list long before he started dialysis, I think. And
especially being a young guy.
How long you're on the list. Yeah.
Especially being young, I'm surprised.
Time on the list is still one of the most important things that determine when you get a kidney transplant.
Yeah, I mean, is it basically also according to age, like a younger person will get it over a much older person? I would imagine that that's the case too, right?
Well, they do want to put the kidneys with the most life in the person who can stand to benefit the most.
Right.
And while there's no absolute age cutoff for kidney transplant, it really depends on if you're healthy enough to get through the surgery. Most centers will not transplant someone above 75 unless they come with someone that's going to give them a kidney, just because the wait list is so long. It can be up to 9 and 10 years in some areas of the country, depending on your blood type and, where you live. So, you think about it, if you're 70 and you're in an area where the wait list is 10 years long, a lot can happen with your health in that time. And so that's why they wouldn't be put on the list. But many programs do have special programs for what they call extended criteria donor kidneys, where, no, they're not perfect, but they're good enough for somebody who really only has maybe 5 or 10 years of life ahead of them, as opposed to a 20-year-old kidney, which ideally would have 50, 60, 70 years of life left on it.
Now, yours is a true love story because, again, you got involved in nephrology because you donated your kidney to your then boyfriend, who is now your husband, thank goodness. And you talk about that quite a bit, really. And you talk about that quite a bit in your book, Hundreds of Interlaced Fingers, a kidney doctor's search for the perfect match. I'm just going to tease that a little bit so people who want to hear more about you and your life and your journey can go out and pick up the book. I'm assuming Barnes and Nobles and clearly on Amazon, correct?
Yeah, and lots of the indie stores like Books A Million, IndieBound, lots of these online places. And, of course, I'm hoping it's getting into lots of bookstores as well. And, yes, the book is part memoir, it's part my story, but it's also lots of stories of patients and colleagues that I've come across over the past decade of my career in kidney disease. And there's lots of information, and my hope is that this is written for a general audience and that people will be better informed so they can make better decisions for themselves and their family.
Yeah, and it's a great read, and it's also a really easy read. And I was, I just like hearing your story and your entire journey into this, and also, touching upon, the Black community that, they have to wait in line a little longer, and something needs to be done about that too. So I'm really glad that you're putting a face to this. I really am. I think that's very, very important for someone like you to do that.
Thank
you. Dr. Vanessa Grubbs, thank you so much for joining us.
My pleasure. I appreciate you having me on your show.
Thank you. We'll talk to you again soon. Bye-bye. Thank you, everybody, for tuning in. I think it was a terrific show. She's very interesting. I know quite a bit. Certainly, I'm not a doctor, but I know quite a bit about this just because my elderly dad, we would take him to dialysis. He had to go 3 times a week. It was heart-wrenching to watch him go through it, but it kept him alive, and he was happy to do it, just to stick around with us for as long as he could. So this one, a shout-out to my dad, Tony. So thank you for being here, and we'll see you next time.